Chronic bronchitis. Chronic bronchitis is defined clinically. It's nothing but the persistent productive cough for a period of 3 months in 2 consecutive years. It especially affects people who are smokers, cigarettes, and cities. So C for chronic, C for cigarette, C for cities, and C for cough. So the pathogenesis is due to this infection through the respiratory tract and air pollutants and smoking. All these things will cause mucous gland hypertrophy, increased mucus secretion, increase in mucin secreting glands, inflammation. Inflammation is caused by interleukin 13 and T cells. And all these things will cause a hypersecretion of the larger airways. And the larger, technically it's a larger airway disease because the chronic bronchitis, the term itself has bronchi, so bronchi is a pretty big airway. And it causes mild airflow obstruction. But there is a component which is small airway disease and coexistent emphysema, which causes chronic bronchiolitis. These will cause significant airflow obstruction, which is really bad. In its morphology, the lung as a whole appears swollen and hyperemic. And this is kind of like the mucus secreting glands, okay? So they become increased in size, so they become hypertrophied, which is diagnostic. And about assessing the increasing size, we have this index, it's called the Reed index. It's based on histopathology. So the thickness of the submucosal layer alone, because this is the layer which has the mucus secreting glands, divided by the bronchial wall thickness. Normally it's 0.4 in 0.4:1 is the normal thickness, a normal Reed index. But if it's more than that, it means it suggests the mucous glands are hypertrophied. So it's more than 0.5, a suggestive of chronic bronchitis. Fibrosis of the lumen will also occur. It's called bronchiolitis obliterans. Clinical features include cough and sputum, which is productive cough, and there's hypercapnia, hypoxia, and cyanosis, recurrent respiratory tract infection causing respiratory failure. Thank you.